KOKO at 9:31 on the Wood Show here on this Thursday morning. We mentioned earlier we would have in the studio with us for a little chat Darinda J, who is the CEO at Western Missouri Medical Center. And with the coronavirus taking up all the news right now, thought we'd ask you some questions about that. Or do you have anything you'd like to say about it? The hospital, are you ready to handle something like this?
Well, obviously, it's a growing concern for everybody. The hospital, we are having, a couple time-a-day huddles and work sessions to continue to change our plans around how we're going to be handling it, because every day it changes with the state.
Yeah.
So we really, it's evolving. And so really what I'm here today is I want to make sure people understand what can be expected if they visit, if they have to come to the hospital for care, what they can do, and what to expect that we'll be asking them.
So it's changing every day then right now, huh?
Yes, it is. The recommendations on travel for employees, for return to work, for all of those recommendations change every day, it seems, from the state. So we have to keep up on that. And most recently, what we've been trying to do is disrupt the care and the flow of the hospital as much as possible. But it is a busy time right now. We have a lot of sick patients. Influenza is still high in our community and in the area. So we are really busy. And so right now, we have had people worried from not really possible exposure, but maybe post-travel, who have been worried about the coronavirus. And so people have presented to our system in various ways. And so I just want to talk about a little bit about how that could look a little smoother for people, so they don't feel so scared and fearful, because we work closely with the health department and the state to make sure that we're getting the appropriate people tested and those kinds of things. So
can I ask you a couple of questions about this that might evolve right into what you want to talk about? Can the hospital test right now for the virus, for coronavirus? Can you test for it?
Yes, we have it. It's a send-out test through the state, and so we do have that capability. But we do get recommendations from the state. So when we screen people and they meet the criteria, we call the health department, and they do a little bit deeper dive screen, and they put the patient under investigation to look into this. And so the state actually follows it, and they decide whether or not the patient needs actual testing, because most times people are worried, and we're being very serious about it. And so we do call and make sure we go through the whole process to screen them out. But almost all patients who are presenting everywhere right now don't really have meet the criteria to be tested, but we do have the capability to test, and the state tells us when we need to do that.
Do you need to be referred by a doctor?
Absolutely not. You do, if you suspect that you've traveled, that you've been in contact with someone with coronavirus, that you have any reason to believe, based on the things that you know, that you have a risk of having coronavirus. They did just yesterday, the Department of Health and Senior Services put out a hotline number. And so we really want to encourage people, the health department and the hospital wants to encourage people to use that number first, because they will go through your symptoms and your concerns with you and then tell you the proper procedure of where to present. So, we've had people come to their clinics, express care, ER. We have lots of entry points for people, but...
Is there one place they should go?
Well, the one place is call the hotline, unless you are so sick.
That's the first thing you should do.
That really is what you should do. Now, if you're obviously so sick and you come to the ER, we're going to take care of you and do all the screening ourselves.
Yeah.
But if you are worried and you think that you might have the possibility, then call the hotline so they can go through your symptoms and your circumstances with you, so that you know whether or not you really are high risk or not. Because the reality is, our responsibility in our community, in the world today, right now, is to try and decrease the spread of this pandemic. So we don't want, if you are not very sick, the reality is most people with coronavirus, they stay home. They are not very sick. They are, it is, the people at risk are really elderly people or people with comorbidities, and so other health problems. And so we want to protect those patients from getting it. So we don't want someone with very little symptoms that have coronavirus showing up and possibly spreading it to a vulnerable population.
What are you changing at the hospital in the way of, if I go over I have a friend over there and I go over to visit him, are you going to keep me from doing that now?
So I do know that most, and I'm just going to speak globally for a second, most nursing homes, I believe, are closing because
are.
they are so susceptible and vulnerable. It's a very vulnerable population. Well, a lot of our patients at the hospital are those exact patients. They are those residents from long-term cares in our hospital. So we do have a responsibility to try and keep them safe. So here's the things that we are doing. First of all, this is evolving, but we are restricting our access into the hospital. So we're going to have just certain doors that you can enter because we're going to have people standing there just to make sure that you understand the guidelines. Are you sick? Do you have a cough or cold? Do you have a fever? Have you traveled outside of, we used to be United States, now it's pretty much any travel because that changes daily. So we are screening people. So there's 3 sets of people that come to the hospital. You come because you're sick and you want to seek care in the ER. Obviously, what we're looking for there is we need to put a mask on you if you meet those criteria. So if you meet one of those criteria, we're going to put a mask on you. If you're coming for a test and you meet those criteria, we're going to put a mask on you. If you are coming to visit and you meet those criteria, we will probably not let you in because we cannot, visiting is a non-essential at most times activity, and so we would encourage you not to come in. However, we will be providing masks to people that come with those symptoms. But we're considering, because we're staffing that, we're considering possibly closing visiting hours a little bit tighter time frame. So just to protect and for us to be able to staff it. I mean, this is really obviously a labor issue for us too, because we have to be able to screen people at those entrances. So that's a plan in progress right today. We want to do it with as little disruption as possible to the visitation. If you have somebody having a baby, if you have a loved one that's really sick, we obviously want you to be with your loved one. I'm very committed to making sure family are around you when you're in a time of need and you're sick. However, we also are just trying to keep everybody safe. And so we're really working on those protocols as late as just 20 minutes ago. We're working on how we can make that look with the least amount of disruption.
So the hospital is ready for any eventuality here, or is getting in that mode right now?
Absolutely. So right now, we are trying to make sure we are taking care of the people that we have in the hospital, trying to diminish their risk of getting exposed. And we also want to treat the people who think they may have it or be able to diagnose the people that would have coronavirus. But we're also thinking long term. The possibility of coronavirus coming to our community is likely. It's likely. And so that's why we're trying so hard, putting in extra cleaning protocols. We have a big thing. We're starting Team Up to Clean Up, where we're twice a day during the daytime. Or day and evening, we're just doing an extra clean. All non-essential personnel, all non-clinical personnel. Or I'm walking out of my office. I'm cleaning waiting rooms. I'm wiping down surfaces, because that is the number one thing you can do to decrease transmission is wash your hands and wipe down surfaces. So we're going to be challenging the rest of the community to do that. So we're doing all that stuff. But what we're preparing for is when we start getting coronavirus patients, how we're already very busy and full, and so is every other hospital in Kansas City. So then how do we resource that? Where are we going to, put people? How are we going to care for them?
Are you going to have to move some out maybe who are not really bad?
Well, most coronavirus patients will not be hospitalized. And so that's the good thing. They will not. They
quarantined at home.
Yep. You will go home and you will, just like if you had influenza right now. It really is just like if you had influenza right now. Like we have patients every single day that come and get diagnosed with influenza, and they get some supportive treatment. They get, a steroid shot and some inhaler, and they go home.
Yeah.
And they convalesce there. But if you have, severe shortness of air and you can't breathe and, your fever's out of control, then you'll be admitted. And so that protocol is no different. That clinical care we're ready for. We can take care of people with coronavirus just like we take care of people with any other acute respiratory illness. So
but
we're ready
space
for
will
that.
be a
But
problem.
space-wise, we need to be judicious. I never say the word hope, because it's usually, I want to say that we plan, but I hope that we don't get to the point here that we're having to restrict, elective procedures so that we have space to take care of sick people. But that is what other countries have come to, is that they have had to restrict some of their business operations in order to take care of sick people. But that's what we're there for, and so we need to be ready. It is really planning for emergency. This is an emergency for the entire country, but as a hospital, we have to be ready for caring for our community and trying to curb this and really prevent the spread of it.
Sure would be nice to think that we won't have any here, but the odds are there will be some.
It is so true. I mean, I really am proud of the efforts that we are taking, that America's taken, because we really have the opportunity to curb the pandemic. We do.
Yeah.
We have the opportunity. If we were not to do anything and we were not canceling big things, big events, we would for sure continue to spread it across, because people don't have an immunity to this virus. It's a brand new coronavirus.
Yeah.
That's why they call it novel. And so people don't have immunity to it. So people are going to get it. So the fact that we're taking all these efforts and they seem extreme, but there shouldn't be fear in it. It really is just to try and prevent the spread, because there is a vulnerable population that if they were to get this, they could, have a 20% of mortality. That's
Yeah.
serious. And so it's our responsibility, and I'm proud of the efforts we're taking, though I know that it is, can cause some fear, and it's
Yeah.
taking over a lot of people's lives right now.
Why does it take so long to come up with a vaccine?
Well, they actually already, I read an article just this morning that said, we're really fortunate. The first case of this was like December 31st, and by January 7th, they had the virus identified. They already have a prototype for a vaccine. So we're actually way ahead of some of the others. The article I read talked about the AIDS virus, obviously very different type of virus, but that took 2 years to pin down what that virus was. And so this, they're swiftly identifying what they need to do to create a vaccine for this. And so, I feel fortunate that it is sad that it's had to get to this point and that some countries have been so greatly affected. And I pray and plan that we will not have that happen in the United States. But I feel very confident that they will come up with a vaccine.
Yeah.
But meantime, it really is our job to try and distance ourselves socially. There's a lot of sad things going on. We can't go watch the Jennies play in their playoffs. We can't go watch the NCAA tournament.
That's what's going to get everybody's attention right now.
Mm-hmm.
Is the NBA shutting down the basketball NCAA tournaments? Are no fans? That's getting everybody's attention that this is pretty serious stuff.
It is very serious, but serious because we're trying to stop the spread. And
that's the important thing, isn't it? To slow the curve.
That's right.
As it were.
And so we certainly can care for these patients. There's nothing in this disease process that is, unknown to us. We have the capabilities at our hospital. We have the capabilities of specialists in Kansas City. Everybody has the capability to take care of these patients, but we don't. We know that it can be fatal for a certain subset of patients who, are high risk for that,
Yeah.
and so we have to curb it.
All right. Darinda, thanks for coming and talking to us today. Is there anything else, by the way, that you need to or would like to bring up here?
No,
about
I
the hospital?
just want to make sure the Division of Health and Senior Services, Department of Health and Senior Services, their hotline, you can find that on any website, but it is 877-435-8411. So if you are worried, please call that hotline. If you present to any of our healthcare clinics or the hospital and somebody asks you some questions and asks you to put a mask on, please do that. Please be compliant, because we're really just trying to do what's best for our community, our patients, and our healthcare workers. And so I would appreciate everybody being kind about that. So
I think everybody needs to know, too, the mask is not to protect you. It's to protect the other people from you.
that's right. Absolutely.
And that's not the way it started out, was it? The people were putting the mask on to protect themselves.
Right. But you still, it's not just respiratory, it's also contact, which is why the cleaning's so important. I know my daughter
Touching
said
stuff.
the schools are she saw her teachers wiping down all the desks, and so,
Yeah.
and we're doing that at the hospital. And we will be challenging the other businesses around Warrensburg next week. Again, we call it Team Up to Clean Up. Where we're designating some times where you just stop what you're doing and you wash your hands and you wipe down your surfaces with the antibacterial wipe, or antiviral wipe. And so
We're also doing it here at the station.
yeah, so it is sad. Everybody says it's sad that we have to be reminded to wash our hands. And it's not that people aren't doing it, but in this time when it's so important, it's even more important to do it more often so that you diminish your risk of getting and spreading the disease.
Right.
So.
Thank you very much for
Thank
taking
you so
time
much,
to come
Woody.
today. I know you're kind of busy over there right now.
It is busy. But if the NBA can cancel, we can cancel.
All right. That is Darinda J, the CEO at Western Missouri Medical Center, visiting with us today here on our Johnson County Today program.